Hello and welcome. Today we'll be exploring a rare and often misunderstood heart condition called left ventricular noncompaction cardiomyopathy, or LVNC. The exact cause of LVNC is often unclear, but it's primarily considered a genetic condition. It's thought to arise from a disruption in the normal compaction process of the heart muscle during fetal development. Several genes have been identified that are associated with LVNC, including those responsible for the structure and function of the sarcomere, the basic contractile unit of the heart. Sometimes, LVNC can be associated with other neuromuscular disorders, congenital heart defects, or even occur spontaneously without a clear genetic link. Lifestyle factors like substance abuse can sometimes contribute, but these cases are less common. To understand LVNC, imagine the heart's left ventricle as a finely sculpted muscle. Normally during development, this muscle compacts, becoming solid and efficient. In LVNC, this compaction process is interrupted. The inner layer of the left ventricle retains a spongy appearance with prominent trabeculations and deep recesses. This non-compacted layer doesn't contract as effectively as the compacted layer, which reduces the heart's pumping power. The deep recesses can also promote blood clot formation, increasing the risk of stroke and other thromboembolic events. Furthermore, the affected heart muscle may be prone to arrhythmias, or irregular heartbeats, which can be life-threatening. LVNC is considered a rare disease and its exact prevalence is difficult to determine. Estimates vary widely, ranging from 0.14 to 0.4% in the general population. This variability is partly due to inconsistencies in diagnostic criteria and increased recognition of the advances in cardiac imaging. LVNC can affect people of all ages, from infants to the elderly. Although it is often diagnosed in childhood or young adulthood, it affects men and women relatively equally. The symptoms of LVNC can vary significantly. Some individuals may remain asymptomatic for years, while others experience significant heart failure symptoms. Common symptoms include shortness of breath, especially with exertion, fatigue, swelling in the ankles, feet, and legs, chest pain, palpitations, or a fluttering sensation in the chest, and dizziness or fainting spells. In severe cases, LVNC can lead to sudden cardiac arrest. Diagnosing LVNC typically involves a combination of imaging techniques and clinical evaluation. Echocardiography, both transthoracic and transesophageal, is often the first-line imaging modality. It allows doctors to visualize the non-compacted layer and measure the degree of trabeculation. Cardiac MRI provides even more detailed images and can help differentiate LVNC from other heart conditions. An electrocardiogram, or ECG, is used to assess the heart's electrical activity and detect any arrhythmias. Genetic testing may be recommended to identify specific gene mutations associated with LVNC. Ultimately, diagnosis requires careful interpretation of these findings in the context of the patient's clinical history and symptoms. While there isn't a universally accepted classification system for LVNC, it's often categorized based on the severity of symptoms and the extent of noncompaction. Some patients may have isolated LVNC, while others have it in association with other cardiac abnormalities. The presence or absence of other conditions can influence the approach to treatment. There is no cure for LVNC, so treatment focuses on managing symptoms and preventing complications. Medications are often prescribed to improve heart function, control arrhythmias, and prevent blood clots. These medications can include ACE inhibitors, beta blockers, diuretics, and anticoagulants. In severe cases of heart failure, a heart transplant may be considered. Patients with LVNC are also closely monitored for arrhythmias, and implantable cardioverter defibrillators, or ICDs, may be recommended to prevent sudden cardiac arrest. Lifestyle modifications, such as limiting sodium intake, regular exercise within recommended guidelines, and avoiding alcohol and tobacco, are also important. Since LVNC is primarily a genetic condition, there are no specific preventative measures that can completely eliminate the risk. However, genetic counseling can be beneficial for families with a history of LVNC to understand the risk of inheriting the condition. Regular cardiac screenings, especially for family members of individuals with LVNC, can help detect the condition early and allow for timely intervention. Maintaining a healthy lifestyle and avoiding risk factors for heart disease can also help optimize overall cardiovascular health. The prognosis for LVNC can vary greatly depending on the severity of the condition, the presence of complications, and the effectiveness of treatment. Some individuals with LVNC may live relatively normal lives with minimal symptoms, while others may experience progressive heart failure and require more aggressive interventions. Recent research is focused on identifying novel genetic markers for LVNC, improving diagnostic accuracy, and developing new therapeutic strategies. Gene therapy and other targeted therapies hold promise for the future treatment of this challenging condition. Understanding your risk and adhering to your doctor's recommendations are crucial steps in managing LVNC and improving your long-term outlook.